Today I'm going to be doing a focused cardiovascular and respiratory assessment on my patient. I'm going to begin by doing a respiratory assessment. So I'll first look at his respiratory drive and inspect if it is symmetrical. So I can see him breathing in and out. It looks symmetrical to me. I also don't see any sternal retractions or accessory muscle use. I don't see any nasal flaring, which are all signs of a good respiratory drive with no respiratory distress. I'm also looking at his skin. It appears within normal limits for his race. I'm going to look at his nails here. He has a good cap refill. And then I'm just going to have you take your nails and go like this together, two thumbnails. And I can see that there's a nice diamond shape, so there's no evident clubbing. So there's no signs of hypoxia. So the next thing that I will do is I will have you turn in your chair here so we can see for viewing purposes. And I'm just going to palpate his back. Do you feel any tenderness as I do this?
No.
Okay, good. And I don't feel any nodules. The next thing that I'm going to do is I'm just kind of go to his T10, and I'm just going to bear hug him right here. And I'm going to have you breathe in and then breathe out. And I can feel that when he breathes in and out, it's nice and symmetrical. And then the next thing I'm going to do is I'm going to feel for tactile fremitus. So I'm going to use the top of my hand, my palm, and every time you feel my hand on your back, I'm going to have you say 99, okay?
Okay. 99, 99, 99, 99, 99, 99, 99.
Good. So I can feel that the tactile fremitus decreases as I move from the apex of his lungs down to his bases. So then I'm just going to take a listen to his lungs. And just take some nice deep breaths for me. So his lungs sound nice and clear, they don't sound diminished, and I would also listen to his lungs anteriorly as well as posteriorly. I listen to them laterally at the bases and at the apex. So the last thing that I will do for the respiratory system is I'm going to have him give himself a bear hug. And I'm going to check for any diaphragmatic excursion. So I'm going to have you breathe in, and then I'm going to have you breathe out. And then I'm going to have you breathe in and hold it. And I'm just going to kind of measure in between. And I can see that he's right about at 4 centimeters, which is within normal limits. So you want to be between 3 and 5. So I will then move on to his cardiovascular exam. So with the cardiovascular system, I'm going to start by assessing his face. So looking at his face, I don't see any abnormal swelling or any orbital edema. I'm going to look at his carotids. So if you just kind of tilt your head this way, I don't see any distension, which would indicate some fluid overload. But what I will do is shine a flashlight. And I don't see any jugular vein distension, but I'm going to palpate his carotids, which are a nice +2. And then I'm going to listen for any bruits. And I do not hear any bruits. So I'll start by just looking at his general appearance. I don't see any kind of palpations at his heart right here. I don't feel any palpations as I feel on each section. I'll feel his apex, his pulmonic, his tricuspid, his mitral, and his Erb's point, which is up here. Then I'm also going to take a listen in different positions. So the first thing I'm going to do is just listen to him while he's sitting straight up. And I'll listen at each point. And I can hear his S1 and S2 on all those points, and I don't hear any S3s or any murmurs. So the next thing I'm going to do is I'm going to have him lean forward and I'm going to listen to his heart. Now this positioning will make it more obvious if there's a murmur, and I still do not hear a murmur. I do hear that his S1 is more prominent at the mitral and tricuspid, and his S2 is more prominent at the pulmonic area. So then I'm just going to have you sit forward, and then before I have him do the last position, I'm going to inspect his cardiovascular system as he's laying down. I don't see any kind of pulsation where his heart is. I don't see any abnormal findings when I'm just observing him. So now I'm going to listen to his heart in this position at all of the points. So starting at aortic, pulmonic, tricuspid. The herbs is right above that. And then the mitral is at the very bottom. The last part of the peripheral vascular assessment is to look at his lower extremities. So as I look at his lower extremities, they're warm, they're dry, I don't feel any edema. His skin color is normal for his race, so I'm going to feel for his popliteal pulse, which is a +2. I'll feel medial to him for his posterior tibial pulse, which is a +2. And then I'll feel for his dorsalis pedis pulse, which is a +2. And his cap refill is less than 3 seconds bilaterally.